don't trust Phuket Plastic Surgery Institute. Just whatever you do, don't trust them. Don't go there. You'll regret it. Well, not unless you want to feel like you should walk around with a bag over your head. My story starts in July 2022, where I first went and had surgery. Then I went back in January 2023, and it's taken me till now, July 2023, to make this video, because as you can imagine, it's confronting, putting out there for people to see what's not right and how deformed you've been left. Let's get the before and after pictures out of the way early so you can see why I have the opinion about PPSI and Dr Jib that I do. Then I'll go into detail about what I've been subjected to by them. Pictures don't lie, so you'll clearly see I'm not just making this stuff up. These pictures show why I and my friends think I've been ripped off, left looking worse than I did, and some suggest they left me disfigured. This is me now, just like in the rest of this video, July 2023, 12 months after surgery. What exactly did I pay to have done, you ask? I say pay to have done because, as you'll see, there is only a slight difference to one area that's remotely visible. Therefore, I have to question, what actually do they do to me in a positive sense? I paid to have upper eyelids lifted, lower eyelids lifted, which is the bags under my eyes, one of the two main reasons I wanted surgery, mid-lower facelift, they had to do this as part of the neck lift, vasoliposuction around my jawline, neck lift, the other reason I wanted surgery. That's it for my face, but I also had liposuction around my middle, my stomach and love handles. I'm not going to show you the photos of that. You just have to take my word that there's no positive discernible difference before or after that either. I'll go into details about the story a little later. As for money, I spent about $500,000 Thai baht with PPSI. Add the travel expenses for the 2 trips, the second of which they didn't do what they said they would do. And the whole experience with PPSI and Dr Jib and Dr Sanguan has cost me conservatively about 1 million Thai baht. That's not factoring in loss of income for all the time I spent in Thailand, which will make it close to 2 million. I'll get the details of why all the travel a bit later on too. Okay, I've kept you waiting long enough. Now, the before photo. This was taken in Phuket only a few days before surgery. I'll give you a few seconds to try and spot any positive differences. Apart from a few millimeters of skin you can see removed from my upper eyelid, I think you can agree that only 1 year after surgery, I look worse than before. Certainly no one could look and say I look better. This is how it looked when I went back after 6 months. So Dr. Sanguan's seen it and said it was better than it was before. If I had a crystal ball and knew the time, effort, money and emotional trauma this whole thing was going to cause, for what's in reality a negative result, I wouldn't have done it. Well, I would have had a reputable surgeon in Sydney do the work. This is what the doctors at PPSI consider better than it was before. And worth $500,000 baht? Seriously? I'll tell you my story and you make up your own mind. I came back from my initial surgery and my own doctor looked at me and said, "It looks like you've just had a holiday." And he knew what was going on. He knew the reasons I was going, the work I planned on having done, and that was all he could say. Like I'd had no plastic surgery done at all. And now 1 year later, I can tell you it's a complete and utter waste of money. The reason I went there was that I didn't want to have to recover at home and walk around my local streets looking all battered and bruised. But now with the money I've spent in my first trip, the second trip, it would have been better for me to just stay at home and go and stay at a resort somewhere while I healed, because it's been a complete and utter waste of money. hopefully prevent other people from making the wrong choice and going to PPSI, and especially trusting Dr Jib to do any work on them. To say that it was a horrible experience and a train wreck of a result is an understatement. So in the July of 2022, take myself to Thailand and have a consult with Dr Jib and get told that it's going to take 2 days of surgery. So liposuction one day and stuff my face the next. Can we just say from the beginning, I knew there was something wrong. And I spent 9 weeks in Thailand arguing with them, seeing them every week and just getting excuse after excuse as to why everything was okay. In the end, it ends up they say, it's better than it was. That's their standard line. It's better than it was. It's better than it was. That's all I heard. I ended up going back 6 months later, but I'll tell you that story in a minute. So what they did with this 2 days of surgery is about 3 or 4 hours the first day for liposuction and about the same the next day. And to any doctors here, now I consulted with 2 doctors here before I went, and then those same 2 doctors when I've come back. So any feedback I'm giving about the procedure isn't just me just sprouting it off. It actually comes from doctors who have looked at it and gone, really? So, because I feel disfigured is how I feel. So this 3 or 4 hours, by the time I actually get into surgery and they get it done, it's actually not a lot of surgery time. So I've come out of surgery, liposuction the first day, feeling battered and bruised, and then the second day for the face. So you come out all bandaged up. This is me, straight out of surgery basically. And straight away, I just knew something was wrong because one of the main reasons I went was for my lower eyelids. So now if you look here, you'll see that it doesn't really look like I've had surgery on my eyes. Okay, this one's not so bad, but this one is, as doctors here go, it should be like up here. Okay, and you can just see this whole imbalance. Symmetry is apparently one of the key things that plastic surgeons strive for, and Dr. Jib doesn't care about it at all. In fact, not even his boss cares about it. Because of course his boss got involved and he was, it's better than it was before. So straight away I could tell there was a problem. So after the 2 weeks and the bandages came off and everything, and the neck support came off, I was going back, and eventually they decided I could either go back in 6 months' time and have the surgery redone properly, as in incisions underneath the eyelash redone to actually pull this skin up, or I could have just a incision along the top of the cheek here and they would pull some skin down. Of course, I'm questioning that's not really the right way, but it's all they could do at the time. Of course, the option was I could have this one back after 6 months when I go back for the other part, but I thought, no, it was horrible, right? It was horrible, right? I hated looking in the mirror, I still do. So I had that part done, which has left me with this funny crease line along here. And so that's my lower eyelids. And of course, doctors here go, that's just all this skin here should not be there, right? That should have been lifted up tight. It looks like I haven't had eye bag surgery at all. As far as my upper eyelids go, if you look, I have this really weird sort of like crease when I close my eyes. And that's because all this up here should have been removed. That's doctors here saying that shouldn't be there. And part of the procedure is they're supposed to go in behind the eye and take fat out. And they're saying it doesn't look like it's been done. Now, as far as my rest of my face goes, you've only got to look at it and go, look at all this here and not so much there. So I've got this total imbalance in my face that's about that much. Okay, about that much. So I hate looking at myself in the mirror because to me it's so obvious. Then with my neck, okay, with my neck, you've only got to look at it and go, hang on, did he have a neck lift? I mean, seriously? I'm due for another one, right? 1 year later, 1 year later and it needs to be redone. I complained about it after 6 months. I'll tell you that story in a minute. But now you've got to look at it and go, this much skin on this side. Look how much skin is on this side. Look how much. Look how much. And I've got this weird lump down here. This weird lump. But that's because there's all this extra skin on this side, on there. So there's no symmetry anywhere on my face. Just none at all. And it should be tighter anyway, all up. And then with the liposuction, in my love handles, I can't really tell a difference. So I had love handles and belly done. And in my belly, I'm not going to show you that part, but it's like this waviness down my stomach. It's not flat. It's not even. I mean, I accept they don't take out all the fat, but it should be noticeable as far as evenness goes, and not noticeable because it's got like this weird sort of like shape down. So it's not. It's like he's just taken out of one spot, not evenly across the whole lot. So I have this weird sort of like shape down my stomach, not flat, but gives me weird ripples. So liposuction, complete and utter waste of time. And I'm not even sure how Dr Jib could say he specialises in liposuction. I really can't see it. So basically I came back and the people who knew that I was going away have looked at me and gone, so what did you have done? Because my eyes still look as tired as my eyes did before. To me, yes, they've got rid of some skin, but it was almost enough just to go say they'd done something, not because it was, let's do the surgery as good as it could be done. It's just better than it was. So what it looks like is it's just a whole rip-off thing so they can put their hand in the pocket of foreigners, rip cash out, and most of the time people have gone home before they realise things aren't right. And once these people have gone back to their homes, nothing can be done about it. They just ignore it. They ignored me and I was there. Okay, every week for 9 weeks I went back to the hospital, have argument after argument. However, eventually, Dr Jib admitted that he'd been too conservative. He'd been too cautious. Now, I would think that's admitting liability, that they would fix it. Okay? Not interested. Not interested. And just as an FYI, good luck trying to find a lawyer or a medical association in Thailand who cares at all about a tourist with plastic surgery. They just absolutely don't. Just not at all. So the only thing I left with was I had these extra incisions here to make my lower eyelids not look as bad. Fast forward 6 months later, we made the appointment there. Come back in 6 months' time and we'll fix your lower eyelids up, right? We'll get rid of all this and fix your lower eyelids up. Back on a plane and to Thailand, go and have my consult. At this stage, Dr Jib doesn't even want to see me. So I have to see the director, Dr Sanguan. Now he's an older gentleman and you would think quite experienced. You know, if you look at all their marketing material, he's extremely experienced. Now, he's looked at me and gone, okay. So what he said is that they can either redo this incision along the bottom there, or inject fat underneath to make it not look so floppy. And I've said, but I was told to come back here and you would do it properly. He's gone, no, that's the only two ways I'm going to do it. All right, so I said, all right, we'll take the extra incisions along the bottom there. It's been done once, so may as well have it done again. In that same meeting, I said to him, now, I've got some other concerns. So I pointed out my upper eyelids. I pointed out this imbalance. And I pointed out this imbalance and this lump here. He's looked at me. This is the man who's the director of Phuket Plastic Surgery Institute. Many years of experience. His answer was, oh, I can't comment on that because it's not my specialty. But he was the man going to do my eyes. So I don't understand. So I had to get another opinion. Just so you're aware, if you mention that you've seen a doctor in Sydney, he gets angry because the only second opinion he cares about is the opinion of one of the doctors who works for him. So it's all just a show. So I went and saw this other doctor. He went through, ended up, they've just gone, we're not going to do anything. Nothing at all. Not even this part here that we'd already agreed to. Nothing at all. What they do is they take it to this thing called a risk committee. Now, the risk committee is made up of senior doctors in the hospital and in the district. But it's not a risk committee for you or for me. What they assess is the legal risk to the hospital that you might do something. And if they assess that you probably won't do anything, or the legal system won't support you and the medical association won't support you, they just wipe their hands of you. And this Dr Sanguan had already decided that before. It was just this whole charade that went on. So because it was high season in January when I went back, it obviously cost me more. And I had to take flights around when I could get them. So I was there earlier than I had to be. And I stayed for 4 weeks afterwards because I knew, I believed I was going to have a procedure and I'd have to be there for 2 weeks after the procedure. And I thought, we'll have some extra wiggle room just in case. So it ends up, I come back with nothing done. So what you see now is exactly what I presented them with when I went back, and they've just not cared. Because all they care about is tourists go there, have a little bit of work, they get to say, oh, we did work because you've been cut. But it's almost cutting so they can stitch you just so it can look like they've done something. You know, if my case was too hard, say it was beyond Dr Jib's abilities, there should have been some honesty and gone, this is beyond me. I need to escalate this to one of my colleagues who's more experienced. Okay, you'd respect that. But to sit there week after week after week, looking and looking and looking, going, but it's better than it was, it's better than it was, it's better than it was. I even had to pull out videos from plastic surgeons as to how procedures should be done to show him going, here, it doesn't look like you've done that. And even at that point in time on my first visit, I had video consults with the 2 surgeons in Australia so that I knew I wasn't just talking out my ass. And then when I've come back, I've gone back to see them and they're both horrified, right? Because in their opinion, I've basically been mutilated. I've been left deformed. I mean, this sort of imbalance is just, I'm not even sure how they can justify it. I'm not sure how a doctor could look at this and go, oh, hang on, this symmetry isn't right, because there is none. So my warning to everybody is, do not trust Phuket Plastic Surgery Institute. Do not get this Dr Jib to do any work. And do not trust this Dr Sanguan, because from my experience, he tells lies. They all tell lies. That's my experience. Take it for what it is. So please do yourself a favor. Don't waste your money. Stay at home. Save the money. Go and stay at a resort near your home or something if you don't want to have surgery and come home and have to rattle around your own area looking beaten and bruised. But at least that way you've got some recourse. And honestly, from the doctors here, they take personal pride in what they do. I mean, a friend of mine years ago had her breast done, and there was one little bit of skin that he hadn't made quite circular enough. He insisted she go back so he could take out 2 millimeters of skin about 20 millimeters long. Then he was happy because it had to be just right. Another friend of mine had her eyes done, and she was told, no, don't need to do that one. So please do yourself a favor. And do not waste the money risking going to Phuket Plastic Surgery Institute. It's not like I'm just one person. Okay, I am one person, but I've had upper, lower eyelids, mid-lower facelift, neck lift. None of my procedures are right. If I add to that the liposuction, that honestly was a complete waste of money, because for my love handles, I can't tell the difference. I really can't tell the difference. So it was 6 weeks of wearing a bodysuit in hot weather, and now I'm going, what did I spend the money on? Because I can tell no difference. And on my belly, you wouldn't even know. Let me just say that it's not like I'm one person having one procedure and you can go, that's one person, one procedure, so those numbers are okay. I had multiple procedures done, and not one of them is done to the standard that Sydney surgeons would call professional. Is the result that you get optimal for you? Is it the best result that could be got for you? And in my case, that's a horrible no. And putting that to one side, the first thing that any plastic surgeon says is that they strive for symmetry. And I have none at all. Just no symmetry, not even close. Not even close. The way it's been explained to me is that it's like they do, say, a facelift, but they do like 2 separate facelifts, one for each side, and each side gets what it needs, so that it ends up looking the same. I have none of that. Again, when I say that, that's all from my own personal experiences. I can't speak for everyone else. All I can go is by the experience I've had and the opinions I've had from 2 doctors in Sydney who have critiqued the work afterwards and can see what I'm complaining about, and they can look at it and they're just horrified there's a plastic surgeon anywhere allowed to do this level of work. And while we talk about it, what do we mean by level of work? I'll explain it. 100% is, say, perfect. It is, for you, the optimal result. 100% couldn't get any better, couldn't get any worse. It was the best could be done without being overworked. And when I say overworked, what do I mean? A friend of mine had her upper eyelids done a few years ago. And after the operation, the doctor said to her, for 2 weeks, you won't be able to close your eyes properly. But after that, it'll be fine. Once the swelling goes down and the skin settles back down, stretches a little bit, there won't be a problem. After 2 weeks, it was perfect. Now, if you had have taken out a fraction more skin, her eyes wouldn't have closed properly. That would have been over the 100%, right? That's overwork. Okay, so 100% is the optimal for you, having done as much as they can without overwork. So anything over 100% is bad. What they tell me is that any good surgeon should be able to get you in the 95% band. These days, 95%, so there's some doctors might get an extra few percent, tweak a little bit here or there based on their experience, but generally it should be up in that 95% for a good surgeon. Even an average surgeon should be able to get above 90%, because they say they consider that's easy to get over at least 90%. And anything below that is basically you've been ripped off, is what they tell me. So everyone's goal is to just start from wherever they are, and for the surgeon to work it up as close as they can to being optimal for you, and making sure that both sides of you are symmetrical, which apparently is the most important thing. So you're going to ask where these surgeons think that I ended up. They would say that I'm about 75% done. So I've been seriously ripped off, and because of the imbalances, really been left disfigured. So from my experience, Dr Jib really isn't experienced enough to do what he markets to do. So I have all these procedures done: upper, lower eyelids, mid-lower facelift, neck lift, liposuction, and not one of them is done the standard that doctors here would say it should be done. In conclusion, let's finish where we started to remind you of what you don't get at PPSI. This difference, my difference, is what the doctors at Phuket Plastic Surgery Institute consider better than it was. We think we're paying for the best it can be. I'm not an unreasonable person and didn't expect to look 20 years old again. Maybe look 10 years younger. I'd settle for 5 for that kind of money. I guess if they'd have said it's the best it could be, then they would have had a case to answer for being incompetent. For saying it's better than it was, knowing the before and after, that would mean they are something else altogether. Perhaps not honest, perhaps not ethical, or just covering up incompetence. I'm still stunned that a surgeon, Dr Jib or Pongsatorn, whichever name you want to use for him, can admit, and I recorded it, that he was overly conservative and didn't remove enough skin anywhere. Then, not to think he's responsible for fixing it. When pushed, he even admitted that he wasn't happy with my result either. So PPSI and Dr Sanguan seem to accept substandard work even when the surgeon admits it. How is there not a liability, or at least professional responsibility, to make things right? They completely wasted my time and money getting me to go back the second time. I firmly believe that Dr Sanguan never had any intention of doing anything when I went back. I told them the problems before I left the first time. They could see it. They could see the problems the second time. They just don't care once they have your money. And there is no one you can complain to. It's the world according to Dr Sanguan. He must be on a profit share. Do yourself a favour and find a surgeon in your own country, somewhere with professional standards as safeguards. Or at least, don't go to Phuket Plastic Surgery Institute. I had basically 8 procedures at PPSI performed by Dr Jib, and not one of them is done to a standard that doctors in Sydney consider acceptable from a professional plastic surgeon. They consider my work amateurish at best, done by someone maybe still learning. From my experience, you don't get what you pay for at PPSI, and they don't care, even if they've left you deformed.